Hey guys, this is Dr. Selene Parekh, the Fantasy Doctor, bringing you information about athletes, their injuries, and implications to return to play and performance. Stevie Johnson, wide receiver for the Chargers, is out for the season. He had a freak accident in camp and ended up with a meniscus tear. Now the meniscus are two C-shaped discs of cartilage. Think of them as shock absorbers that sit in your knee that help pad the femur bone or your thigh bone from the tibia bone, which is your shin bone. So they sit in between the joint and act like shock absorbers so the bones don't crush on each other. A tear of the meniscus may involve surgery. In his case, it did. Now, depending on where the tear is, you can just clean out the tear, which would mean a return to play in about 4 to 6 weeks. And that would happen if the inner part of the C, okay, the part that's kind of the inner part of the C, is torn. In his case, the outer part of the C, so the back end of it, was torn. And that's an area called the red zone, which has a lot of good blood supply and can allow for the meniscus to repair. So that recovery is a lot longer, anywhere from 6 to 8 months or even longer. So he's done for this season. Look for him to make his way back into training camp next year, and we'll have to see how he performs. Oftentimes people can bounce back from this injury fairly well, but sometimes they can struggle. So again, we're going to have to feel this out as time goes on, but he's done for 2016, but will be available for training camp 2017. This is Dr. Selene Parekh, your fantasy doctor.